What's up, YouTube? This is your daily dose of mental health. And in this video, as I said, I was going to put out a new video Friday in my Tramadol journey. This video, we will be discussing more so early Tramadol, my early Tramadol days when I was actively using. I've talked about how I've gotten clean. This one will be more so what life was like, a more in-depth look. So yeah, please like and subscribe if you like the content. I'm going to be doing a video, as I said, every Friday. It'll be out every Friday. So yeah, like and subscribe, comment on your experiences, or if you have any questions. I'll gladly respond to it. So let's get it going. All right, guys. First and foremost, this video will be discussing in the series, the Tramadol Journey. This is going to be focusing on early in my active addiction and kind of what sparked, what I feel like the moment was that sparked my actual what caused the addiction and for it to start to spiral. First off, I got a buzz cut. Wanted everyone to see that. It's time to get a haircut. Feels so much better. It's hot here. It's 100 degrees every day when starting a new job. But anyway, so early on when I first started taking Tramadol, I took it because let me back it up. First off, I took a little bit of hydrocodone. I had a prescription, I had my wisdom teeth removed, and that's when I started. It felt so good, I'll never forget it. Took a couple and it just felt like I was floating, but you only get 10 to 12 of them. So I had to go into other measures to get another drug that was close to it, and I found some Tramadol. And I don't really want to go into details who I got it from, but I had essentially a huge amount at my disposal most of the time. I'll just put it that way. So yeah, I started Tramadol after as I said, I got my wisdom teeth out. And I did actually, the thing that was crazy about it first, when I got my wisdom teeth out, I told you I was taking hydrocodone with a prescription. And I did develop dry socket, but they wouldn't give me anymore because they said there was surprisingly a limit. And this is when, 3 to 4, actually more so like 3 to 4 years ago is when they really started cracking down, in particular on the opioid crisis when it first started, and they were starting to cut people off, which in itself kind of did even more damage, because you have cancer patients and you've got patients who have multiple knee surgeries and whatnot and have to have follow-ups, and then they've been on doses of pain meds that have worked and they cut them in half. So I understand why they were being a lot more cautious for people, because of what was going on, which is finally being mentioned, the opioid crisis. But at the same time, it started screwing over people who actually did really need them for chronic long conditions. And I'm talking people who were in constant pain, suffering. That's who these are intended for. How they were promoted in the 80s and early 90s was they're not addictive, especially oxys, blues. So in Florida at that time, you could get as much as you wanted. But anyway, off that, I'm going to talk about Tramadol. So I had access to some Tramadol, a lot of Tramadol, and at first I started taking it, and I'm going to be real honest. So I took a couple of them, 250 milligrams first time, and I felt okay, a little relaxed. But then I upped it to 3, and that for some reason, and I know some people say 150 milligrams of Tramadol isn't a lot, but you got to realize, for some people who don't have, and remember, I wasn't using things, I didn't have really a history of using opiates or opioids. So for somebody, I understand how some people are like, oh, I've taken hydrocodone and pain meds a long time, then I took a couple of Tramadols and it didn't do anything for me. Well, remember, for somebody who's never, besides like their wisdom teeth, had pain meds, Tramadol is still a very strong pain med, and it has more dangerous side effects from it, and the withdrawing process actually can be a little bit more complicated. I'm not saying it's harder than your normal opioids like hydrocodone, oxycodone, but it does have more effects, different types of withdrawals, meaning, as I've said in earlier videos, obviously dopamine. It has effect on your dopamine. It has an effect on your serotonin and norepinephrine, tramadol does. So that's why one big reason with the serotonin and norepinephrine why you're at a higher risk for having seizures. That's why they say on that you can't, the one thing I'll say is if you were taking tramadol daily for a long time and you were taking oxycodone or whatever, or Oxycontin or hydrocodone, surprisingly the one that you would be safer to cold turkey would be the oxycodone and hydrocodone, because tramadol you could have seizures if you don't taper properly. So I started taking that, and then I'll never forget one time. This was when I was in college, and I had a teacher who told me, she accused me one time of cheating, and I actually didn't cheat, and I tried to explain it to her after it, because sometimes, like when I was taking this test, I'm not gonna lie, I was turning and stretching. I do have some back issues as well, and it will randomly cramp on me. And I've told teachers that in the past, and I have to literally, like, for example, turn to pop my back. And she said I cheated, and she literally threw me out of the class and failed me for the test. And for some reason, I feel like that was the experience that set me off. Meaning, I'm not saying if she wouldn't have done that, because it was really, I'm not going to lie, it kind of caused some psychological trauma. It embarrassed me. It was just, for me, it embarrassed me, and it made me feel like I was a horrible person for having a condition of having, like, back cramping. And eventually I did talk to her, and she worked it out, and I got to retake the test. But by the time that happened, the damage was done. Meaning, that's when I started using it, and I just kind of said fuck it to everything. And I'll say, like, I would take 3, and then sometimes I would take 3.5. I know in some prior videos I said I'd take 3, 150, but it just depended. Sometimes I would take 3.5, and the thing I'll say is there were some days I'd average around 3 where I'd be popping 6 of them. And it just started to get out of control. I mean, yeah, I was still surprisingly doing homework. I was functioning to an extent. I even worked, which I don't even know how the heck I did that. But it got to a point where I couldn't go anywhere without taking that stuff. I was just always anxious, always just, in all honesty, I was just always, it made me, when you first start taking it, it really helped. It helped with the pain, and it just made you feel chill. But I noticed as time went by, it just became a chore. Like, I'd take it just to feel like normal, and I realized that it was something that when I was taking it, it literally was just trying to make me feel normal. And when I didn't take it, I'd just be in constant fear and anxiety, all sorts of things. But I will say that the reason why I wanted to make this video in specific is because I do truthfully believe that, they talk about with having, with people who are drug addicts, there being a biological aspect, a psychological aspect, and I do know, and I am aware that there is alcoholism that runs in my mom's family and some pill problems. Now, it could have been a combination of that, plus, for me, having some sort of major trauma go on is what you, for me at least, is what you really need to look out for. So, if you notice somebody who's went through a trauma even recently, not just when they're a kid, that could obviously have an influence, but I'm talking like when they're older, even in college, watch out for your friends. Ask them how they're doing, because trauma affects everyone differently. And it can even be something like I said, where I got called out for cheating in a class where I truthfully was not cheating. In college, I never cheated. I mean, in high school, I'm not going to lie to you. I mean, a lot of us would copy each other's worksheets and stuff. I mean, it's high school though, bullshit assignments. But in college, I never did. And it just messed me up. I don't know why, but that's kind of what threw me overboard. Now, first off, I'm not going to say, as I said, if that wouldn't have happened, I was still taking the meds at that time. Would it have spiraled? I still think it would have, but we have to keep an open mind to trauma. And I'm not going to lie to you, like, probably like 3 years ago, before I started nursing school, if you were to tell me I'd be making videos or anything like this, I would call you a fool. I've always liked to help people. That's why I went into nursing, but like getting in front of a camera and stuff and telling everyone my life, hell no. I would have said, you're fucking high yourself. I'm never gonna do that shit. I never would do that. But I just feel like during what we're going through right now, that there's going to be a lot more mental health issues, and there already are, that people just need to hear people's stories just to know you're not alone. Because I was fortunate enough to have some friends to help me, and I know a big thing is with a lot of drug addicts, a lot of us get to a point of where, and when I was in my down spiral, I was isolating. You start isolating, your drug becomes more of a priority than family, friends, and everything. And looking back on it, I can't believe what I was doing. So I just want to end this with saying, look, and I'll make videos on how I got clean and everything. I've already made a couple of things that have helped. But if you're struggling out there, I just want to let you know that, and to everyone watching this, that don't just think of your drug addict as being some like person who looks like a drug addict with no teeth, homeless, etc. A lot of them are functioning addicts that have serious problems that are honestly kind of asking for help. Even if they're denying it, that they don't need help, telling them you're worried about them or whatnot, or asking how they are, it might piss them off initially, like it did with me, but those are the things that help. So I encourage you that if you don't have anyone to talk to during this time, while you're going through, if you're thinking about quitting a drug or really anything in that regard, try to find a social group, even if it's online. If it's AA or NA, AA or NA did not work for me, but I've seen it work for lots of people. And the big key is just finding a group that you can be familiar with, because that's a lot of it. Because a lot of it is just, a lot of what it is just knowing you're not going through this alone. That's what the biggest part is, in my opinion. And yes, there is physical withdrawal, but that the AA and NA groups are really there for, in my opinion, those for the post-acute withdrawals, the mental cravings, because the physical withdrawals people can get through. It's that long-term stuff that's rough. Check out some of my other videos. If you want another video on my Tramadol Withdrawal Journey, I did one about a year ago, and I've been putting out a couple more, and I'll put some at the very end of this video, some links. They should pop up as like the cover photo for them. The very end, you can check a couple of those out. And I'll throw those up there. But yeah, check it out. I want to make it a whole playlist from start to finish of my Tramadol Withdrawal Journey. All right, everyone. I love you all. Let's have a great weekend. I'm about ready to start a new RN job as well. This coming week, I'll start orientation. So yeah, I'll be making more videos in general about the Tramadol Withdrawal Journey. The Tramadol Withdrawal Journey. I'll be making it in regards to, I'll be making mental health videos with different diseases, diagnoses, just general videos that are helpful for others, and just motivation. But I'm focusing right now on the just kind of one video a week on like Fridays, putting it out, just with timing and whatnot. But I'm going to try to put more and more out as I get more familiar with this new psych job I'm working. So love you all. Let's have a great day, and let's get after it.